But we're here talking about Medicaid and Medicaid expansion, and I'm going to tell you right now, Medicaid was never intended and never designed to be a substitute for health insurance. My parents at a time in their life, my grandparents at a time in their life, and myself at a time in my life went and we didn't have health insurance. And you know what? We're still here. We rode bicycles without helmets. We're still here. We ran around with sticks. We're still here. Instead, Medicaid was really designed to be a reimbursement program for hospitals and healthcare providers to mitigate the cost associated with providing care for the most vulnerable, our indigent, our disabled, and our children. We've proposed in the Senate a comprehensive healthcare package this year. It increases competition, lowers premiums, and provides lower costs for services. It makes catastrophic care coverage available to more Virginians. So I'm one that's a facts and figures. I'm a facts and figure kind of guy. The one thing I'm going to tell you is I'm going to cite where all my stuff comes from. So you don't have to guess. You don't have to think, oh, where did he pull that from? I'm going to tell you. So increased private market participation, Senate Bill 844. It expands the opportunity for low cost, no strings attached health insurance for all Virginians with a less expensive short-term coverage plan that's offered 364 days, so 1 day short of a year, and it has the option of renewal. President Trump designed this as an option for the health insurance companies to go around Obamacare. And that's what he's done. That's what we've adopted. We've provided that in the Senate this year. The House has approved it as well. Catastrophic health care coverage, Senate Bill 964. What that does is requires health carriers participating in the individual markets to offer low-cost catastrophic plans for health insurance. So for young professionals, independent entrepreneurs, really those who are very, very healthy and don't need expensive health insurance because they're fine. They hardly ever go to the doctor. I think the last time I went to the doctor was about, well, actually I had a little fall. I had to go to the doctor, but other than that, it had been almost 2 years. So for those folks, it provides a very, very low-cost premium, a little bit higher deductible, but truly what insurance was designed for, catastrophic coverage. Senate Bill 934 and 935 really went and looked at authorizing an association to sponsor a trust, a pool, so they can have their own insurance pool. So an example of that is like the Virginia Chamber of Commerce is going to put a pool together so any member of the Virginia Chamber of Commerce can join that pool. Liberty Healthcare is another one that does that. But they can join that pool. It's a self-insured pool, or they can go out and buy insurance for everybody in that pool. So that right there will create the competition. You'll have the group in a private market with a lower cost of healthcare and health insurance. That's what we need. We need innovative ideas that are outside the box and outside Obamacare. Prioritizing those who most need, has the most critical need in Virginia. So that's Senate Bill 915 that I'm going to get ready to talk about. So who should we provide Medicaid for? Those who can't provide it for themselves. Our intellectually disabled, our developmentally disabled, and our children. That's who we have a responsibility to provide Medicaid for. Senate Bill 915, we actually do that for everybody on the list today that's in one of those three categories. So when people come and say, oh, we've got to expand Medicaid, the poor kids. Well, the kids are covered under the CHIP program and the expansion of what we're doing in Senate Bill 915, which is for our most vulnerable population who we should be taking care of. So the impact of Medicaid expansion, it's simple. You've got less money for schools, less money for transportation, less money for roads, less money for infrastructure, less money for public safety and security, the core roles of government. You've got less money for it. So I'm going to hit you with a couple of statistics real quick. A whole bunch of states have expanded Medicaid. What's happened? Over the last 3 years, their Medicaid pools have increased and the cost of Medicaid has gone up drastically. Here's an example. Nevada, in the last 3 years, 93%. It's gone up 93% in the last 3 years. That is ridiculous. That's unconscionable. We cannot continue to do stuff like that. Imagine in Virginia, The cost of our health care right now with Medicaid, if we expanded Medicaid, imagine it going up 93%. That's less money for roads, less money for transportation, less money for public safety, less money for kindergarten through 12, and less money for higher education. These are the things we should be doing. If we're concerned with poverty, we should educate our way out of poverty. That's the way to do it. We've got to focus on this. So here's some other states that have had huge increases. California, 63%. Colorado, 67%. Illinois, 44%. The House has modeled theirs after the Kentucky plan, a work plan. I won't go into all the details of that because we'd be here all night. But Kentucky, 69.49%. So almost 70%. So let's think about that for 1 minute. The cost of their insurance has gone up 70%. What happened in Kentucky this year? They've announced a tax increase. They have to increase taxes to pay for the expansion of Medicaid. It's not free money, it's our money. Our local money's in one pocket, our federal money's in another, and our state money's in another. It's all our money. It all comes from the same source. It doesn't magically appear. That doesn't happen. It's not Lucky Charms. So West Virginia just had a big teacher strike, and the cost of Medicaid in West Virginia went up 45%. We talked about New Hampshire, 66%. Oregon, 83%. New Mexico, 56% in the last 3 years. And it goes on and on and on. Every state that's expanded Medicaid, the cost of their Medicaid insurance has gone up drastically. It's not free money. Under the Trump administration, they've come out and said, and even Obama, under his last year, Obama came out and said, we're going to go for 90% reimbursement to 80% reimbursement. If Virginia had expanded, that would have been another $400 million that we would have had to dig out of our pockets and pay. It's not free money. The rest of Medicaid's reimbursed from the federal level at 50-50. It's going to be back to 50-50 in the next 10, 15 years, and guess who's going to pay for it? You and I through our tax increases. And I'm sorry, but I think we've already saddled our children with enough debt in the future. So let's hit a couple of other things, and then I'm going to open it up for questions. On the Medicaid expansion facts, in 2016, $553 billion. That's the cost of Medicaid from 2016. To cite my source, the Kaiser Family Foundation report on total Medicaid spending. Again, if you're going to put facts and figures out, cite your source. So from my standpoint, rather than spending $2 billion, and if we follow the House expansion, it's almost $3 billion the way our House did it, but they didn't take that money and put it to the 2,700 people who need it, are intellectually disabled, are developmentally disabled. They took that money out and they did it on unsustainable things. Salary increases, pay raises. When you give somebody a pay raise, you have to pay for that every single year in the future. You also have to fund their VRS, Virginia Retirement System. So let's think about that for a minute. Under the Senate program, we've done this without Medicaid expansion. We've covered that 2,700, the most vulnerable population, those who need it the most. And we've done it in a conservative way, allowing those who need insurance the ability to get insurance. I think we've done a great job with the Senate budget. We're going to continue to do that. We're going to continue to focus on this, and I think that's the right thing to do. That's what it's about. We don't need to do Medicaid expansion. We need to focus on out-of-the-box, innovative ideas and concepts to take care of our future, take care of those who we should be taking care of, and then making sure there's other insurance products for everybody to get. So with that, I'd like to open it up for any questions.
Are all of the local delegates in line with you?
Delegate Jason Mieres is in line with me. I'm not sure who else is, if any. I only know Jason because I've talked to him. Tom? And then
Yeah, we heard from Senator Stalling, and I just heard about Frank Wagner, and we heard of Glenn Davis the last time we met. All three of those said that they were voting for Medicaid expansion because they couldn't stop it. Their excuse was, since we can't stop it, let's get the best bill we can. What do you have to say to that?
Well, my mom always said, if your friends jump off the bridge, are you gonna do it too? No, thank you very much. I took an oath of office when I was in the military, taken an oath of office every time I've been elected, and I said I'm going to represent the people. I'm not going along with the majority on anything. There are people who have said that I'm gonna do it because Emmett Hanger said he's gonna do it. Emmett Hanger said he's gonna do it if there's no hospital tax. That's what he said. The House budget that's always moved forward has a hospital tax. Again, Emmett's won. We have a 21 majority in the Senate. And frankly, why would you go against what you believe in to go along with the majority because, oh, it's gonna happen anyway? Sorry, not gonna do it, you know.
That's the problem. I mean, that is what creates the problem.
Exactly, Nora. That's what creates the problem. You elect us to represent you. You don't elect us to get along. You don't elect us to go along with everybody and everything. And you certainly, we're the buffer between you and the government. We represent you. Your problems are our problems. We're supposed to represent you and speak on your behalf. And I don't think anybody in here said, hey, if Emmett Hanger folds, or if this doesn't work out this way, then you should just switch your vote to go along with the population or with the majority. No, thank you. And John will tell you, if that happened, we would never have had a unanimous budget on city council. John and I stood our ground, had the first unanimous budget in 20-something years. It was over 23 or 25 years when he and I worked together on this. You know what? We stood by our principles. We said we're not increasing taxes. We didn't increase taxes. I worked with the mayor and Lewis Jones, and then John flipped. I worked with the mayor, then we flipped. John worked with the mayor. I went to Lewis Jones. John was with Lewis Jones. We flipped back. We went back and forth. We hammered out a unanimous budget. That's how you do it. You don't say, oh, well, just because he's going to do it, I'm going to do it. No, thank you very much. That's not who I'm voting for. So sorry.
Unfortunately, that's not generally the rule.
Again,
most politicians I know are unlike you and John.
Well, I don't do this because I have to do it. I do this because I want to do this. Yep, I'm sorry.
you.
Let me hit the gentleman in the back in the blue shirt. Did you still have a question? Or?
They get one.
Okay. Young lady up there, and then the Commodore.
Senator, you've already got the right way of talking about this. You already have a good decision made for us that will help us keep our taxes low. How do we help you get the results we need to have it carry? How do we get the Frank Wagners and the Stolleys and the people who are Davises, who are obviously turncoats or just not thinking clearly about this? Because these people need to understand that we are already overtaxed on the city level, and we are all, trying to make it here. We're facing 2% annual increases on the city budget, and John is trying to hold the line on that for us, but the costs keep going up. We're gonna have an April 25th and a May 1st rollout of more debt and more taxes. We've had it already last year. We just can't have it at the state level too. So how do we help you help us? Tell us what to do.
You talk to Delegate Glenn Davis. You talk to Delegate Chris Stolle. You talk to Senator Frank Wagner. You tell them it doesn't make logical sense to do it. There's other ways, there's other opportunities, there's other options. That's what you have to do. You have a voice, make it be heard. I want to thank everybody who's been out walking for me the last few days. I certainly appreciate it. I've had a lot of folks interested in telling me how they think and how they feel. They're backed by 7 different billionaires and super PACs, and that's okay. Keep telling me how you feel. You live in California. I don't represent you. You can't vote for me. Well, actually you can, because what they did the last election is they moved a whole bunch of people into the districts, and on October 1st, 30 days, more than 30 days prior to the election, they had them walking, they registered to vote, they voted for their candidates, then after the election, they moved back to their home state of record and re-registered there.
That's allowed?
It's allowed because the way our law is structured, and I'm not going to change this law, it's a good law, it's done for our military and others. If you have to live there for 30 days and you're allowed to register to vote. If you've lived there for 30 days, you should be able to vote. And frankly, I like that rule. I think it's a good, reasonable, logical rule. It's just being misused. So, you know, we have ethics. We're responsible and accountable to ourselves and our conscience, and that's the way you got to think about it. So
These people vote with a big wallet. That's
they
what
vote with a very large wallet. Commodore?
Bill, can you contrast, and I like what you said in the first part, telling about the different bills that you guys have put ahead. Can you contrast what it would mean to the average Virginian who is looking to get Medicaid, and the difference between what we're proposing on the Senate side and what we propose on the House side, and actually getting the Medicaid? We know what the cost is going to be, but what does it mean to the average citizen who does not have health insurance that wants to have health insurance?
Okay, let me walk you through it. So 5 years ago, before Obamacare, 6 years ago, something like that, one of my friends, neighbors, they paid him and her, their kids moved out, graduated school, got married. They paid $750 a month roughly for health insurance, $756, $754, somewhere there, let's say $750. When Obamacare came in, they were both forced to go on Obamacare, okay? That went up to $1,200, then $1,600. At the time, they had 2 years left to pay off their mortgage, and their mortgage was $1,600. The next year it went to $1,600. Next year it went to $2,600. Last year was $3,500. This year it's $4,500. That's $50,000 a year for health insurance. They're in their late 50s. They're healthy. They go to the doctor maybe once a year. They don't have any issues. They should not be paying $50,000 a year for health insurance. That's ridiculous. They don't make but $65,000 a year. That's ridiculous. We gotta stop that. The Senate put together programs and plans to fix that. Logical reasons, a logical way to do it. So, Commodore, you asked, what does it mean to the average person? That's what it means to the average couple who doesn't get sick. For somebody like them, there'd be low-cost insurance, catastrophic coverage, or the cost of what their mortgage was. That's crazy. That's insane. We've got to get the government out of this, because if we do this, the next step is going to be nationalized insurance. And that's the wrong way to do it. The government's got to stay out of it. We've got to get it back to free market, free enterprise, and what this country was founded on. Back here, and then Mr. D.
Okay, so if you were going to try to explain your plan and why it's best for the individual, going door to door, talk to someone at a bar, or just in general that does not agree with you, how would you go about, like, what's your best talking points or your best, like, 30-second spiel that you give to someone to try to convince them to, like, agree with you?
So my best 30-second spiel, it's easy. The Senate put together a program that did three things. It provided a low-cost catastrophic plan for individuals who are healthy and can't afford it. It provided a short-term 364-day plan with lower insurance costs to have complete coverage, renewable at 364 days to go around Obamacare. And it provided insurance for the 2,700 intellectually disabled and developmentally disabled, those who we should be taking care of, those who we have a responsibility to take care of. So the way we did it, it saves money because you're not taking money away from schools, public safety, transportation, infrastructure. Our job as elected official is our number one job, safety and security of our citizens. Okay? It's not to make sure everybody in the world has health insurance. And in Virginia Beach, we have this wonderful thing called Beach Health Clinic. And I can tell you that almost any time you call them, the wait, unless there's a catastrophic issue, the wait is less than an hour. Most of the time when you call, it's about 20 minutes. You know, that is our safety net. These other programs are our safety nets. That's what we need for insurance. There was a time in my life I didn't have insurance. My parents, my grandparents didn't have insurance. You know what? Did okay. Did all right.
And that kept costs down for the medical providers as well, because they didn't have to be forced to have this whole administrative staff to deal with insurance companies that were really taking over everything.
Absolutely.
Senator DeSteph, you just got back from Richmond over the last 3 days. What do you expect to be the series of events upcoming for Governor Northam's budget with this thinly veiled threat that it's going to stop localities from developing their budgets because so much of the money from sales tax, et cetera, come back to the cities, and they're putting out this threat that, well, if you guys don't get together, we're not going to have a budget and we'll have to shut down the government. Could you respond to that, please?
First of all, it takes more than that to shut down the government. Thank you very much. Secondly, and I had been talking about this since I think we were getting ready to go Sunny Die the end of February. And it's easy. I told everybody we're going to come back 11 April. We were going to discuss the budget. We're going to go back on the 18th for veto session. We still weren't going to have a budget. We were going to wait till the recalculation of the federal tax dollars and the taxes coming in. So once we had that re-benchmark of the budget and the taxes coming in, then we would meet. That normally happens the last week in April, first week in May. After that, we'll go back and address the budget. Now, how do you address the budget and make it responsible? The first thing you do, pull Medicaid out of it. You have a responsible budget. You discuss Medicaid and how you're going to get it covered. The Senate budget provides that safety net you need. It covers those who need it. What happened, the governor came out with a budget after session. Once we went Sunny Die, what happens is the budget that's there, since it's not agreed upon, it dies. Governor sends down another budget. He sent that down. Tuesday night, the House passed it. Gets communicated to the Senate, usually takes 2 or 3 days. Comes to the Senate, we look at it. All the House did was they took the governor's budget, threw it away, took their budget, put it there, and said, here's our budget. Same budget they had last time, a couple little tweaks, nothing big. They put it forward. So here's what I think is going to happen. We're going to go back in May. We're going to spend a couple of days there. We're going to put something forward. I hope we put the Senate budget on top of the House budget. We push it back, and we take and do a special session to discuss Medicaid expansion. We roll up our sleeves. We have honest, factually driven conversations about it. Let's face it. What are the talking points against us? Oh, poor people and poor young children aren't going to have health insurance. Okay, they do through the CHIP program. They do through Medicaid the way it is today. Are intellectually disabled or developmentally disabled. What's one of the other ones I hear all the time? Oh, our elderly people won't have insurance. That's Medicare, not Medicaid. They do have it. So once you get the emotional talking points out of the way, focus on the facts and figures. We can provide talking points for everybody. We can cite anything you want. We have talking points forever on this stuff. I've shared them multiple times. We'll share more. You want to work together, we'll work to get it down to a 15 to 30 second talking point for everybody going out there. The bottom line, the Senate put together a great forward-leading program with those 3 things: increase competition, lower premiums, provide lower cost services, make catastrophic coverage available, and cover those who need it, are intellectually disabled and developmentally disabled. So with that, guys, I want to thank you very much for your time and being here. Young lady, last question.
What was the favorite bill you passed and your favorite bill that you were like no to?
Okay. Favorite bill I passed. We actually had the one, and this was one of the bills, and this was one of my bills. There are a few others I really enjoyed doing, but this was one of my favorite bills. We had an issue with dangerous dogs being brought into Virginia. If the dog had a bite history, it was never being recorded. We had a dog that had bit multiple people. I think there was 5 or 7 bites, a bite history of 5 or 7 times where it really hurt individuals. That dog was adopted out. They didn't know it. They were never told. So we did a bill called basically, you have to ask when you get the dog, and you have to tell them if the dog has a bite history. We had an elderly lady here pass away because she was killed by the dog. There's one in Richmond and then a few other places around the state. The best bill I killed, there were a lot of them. There was quite a few of them. Every single one of them had to do with tax increases or taking anyone who is a convicted felon and giving them automatic restoration of rights. We had one that dealt with child sexual predators, and it gave them a restoration of their rights. And I'm sorry, it shouldn't happen automatically. You should go through scientific testing before you even allow that person to get out, in my opinion.
Voting rights,
Voting rights.
not gun rights.
Well, you're a felon, you don't get gun rights. I'm talking voting rights.
Right, exactly. So,
Yes.
you know, automatic of one kind, but not the other kind.
Correct.
Yeah.
Oh.
Correct, yes, I'll clarify that. And then there was another bill that allowed our Department of Health and Behavioral Services deal with our most vulnerable populations. We had the lady in Virginia Beach who stole $50,000 from one of the intellectually challenged individuals. She was there as his financial advocate. There was a bill that basically would have allowed a convicted felon who was convicted of burglary being breaking into somebody's house at night with the intent of stealing something and with the intent of knowing that they're gonna be home when you did it. We were gonna allow them to work for Department of Health and Behavioral Services. I just couldn't support that. So those are some of the bills that we disposed of, but billions and billions of dollars in tax increases, and we disposed of a lot of those very early. There's a lot of regulations on our businesses, and let's face it, what do you want me to do? You want me to go up there and create an environment for our businesses and families to thrive. That's what we should be focused on. And that's what I do. Thank you very much.